Hello, my name is Cassidy Hanson. I graduated from UNI with my bachelor's in health promotion and education in May of 2021. I'm now working as an epidemiologist at the Iowa Health and Human Services. I've been here for about 6 months now, so I'm still a little bit new and learning lots, but I specifically work as the oral health and the PRAMS epidemiologist here at Iowa HHS. PRAMS stands for the Pregnancy Risk Assessment Monitoring System. And with that, a survey gets sent out to moms asking about experiences before, during, and after their pregnancy. So I'm kind of in charge of analyzing all of that survey data that we collect through that and reporting out those results. And then on the oral health side of things, I work a lot with the state's oral health program and the data that they collect. And then I also assist with a lot of grants and evaluation activities for them as well. So that's kind of the gist of what I do. I feel like my education at UNI has helped a lot in my current job and while getting my master's as well. I kind of went into my master's degree a little bit nervous just because a lot of my peers had a more science or medicine background than I did. The program at UNI is very heavily focused on like education, health promotion, and programming. And so I was kind of coming in with a little bit of different background than everyone else, but I quickly found out and have realized now that has been the perfect component or complement to my epi degree and my career right now, especially working in a public health department. It's really helped me look at data in a different way than those without my sort of bachelor's background. I kind of focus on what you can do with the data and kind of use it to inform programming and evaluate processes and make improvements. So an example of that is we are kind of seeing that there's been a decline in dentists that accept Medicaid, which means fewer kids and adults who are enrolled in Medicaid get services from a dentist or have harder time accessing them. So we're always trying to think of ways that we can use that data to showcase some of the negative effects of that trend and, the difference that it will make for oral health across Iowa. I would say some of the skills that I use the most in my job would obviously be data analysis as an epi. It's a big one. Communication skills are really important, both for communicating data as well as just everyday work needs and things like that. It's a really important skill to have. And then program evaluation is another really big one that I feel like the program at UNI helped prepare me for. The program focuses a lot on, all the steps of programming. So planning, implementing, evaluating. So that background of mine really, really helps me in my job right now in those aspects. And then advice for students, I would say don't be afraid to kind of step outside of your comfort zone and seek out new or unfamiliar opportunities. One of those being grad school. I know you probably don't want to think about more school, but I kind of took that leap and chose to go for epi when I didn't really know a whole lot about it. And I'm really glad that I did. And then I would also say if you plan to work in some sort of government sector at some point, I've learned that adaptability and flexibility are really important skills to have because there's always changes happening and you just have to kind of be flexible and make the most of what you have or what you are given.